Welcome to another episode of Southern Arizona's Nonprofits, the superheroes impacting our community. We're broadcasting live today on the Tucson Business Channel, a division of Mark Bishop Media, from the Stewart Title corporate offices on Broadway in Tucson, Arizona. And we're brought to you today by SCIP, SSCIP, the social service contractors indemnity pool that's been insuring nonprofits like ours for nearly 3.5 decades. I'm Barbara McClure, Executive Director of Impact to Southern Arizona, host of the show, and with me today are two community leaders from organizations focusing on health for individuals and families, but also through the workplace. Please join me in welcoming Mr. Dan Johnson, Executive Director of the Wellness Council of Arizona.
Great to be here with you, Barbara. Thank you for the invitation. This is a great day.
You're so welcome. I'm excited to share with everyone what you do. It's amazing, and I think there's a big trend leading that direction, growing trend. So we're excited about that. And then also I have Kimberly Mayfield. She's the Director of Marketing and Communication at MHC Healthcare.
Good morning, Barbara. Thank you.
Thank you for joining us.
Thank you for having me.
You are so welcome. And I will share with the audience that usually we have a gathering of nonprofits, but with us today with MHC Healthcare, I wasn't sure if MHC Healthcare was a nonprofit or for-profit.
Oh, we're nonprofit. We always have been.
There you go. I thought so. But one of the reasons we have included them is because they are sponsoring they're the lead sponsor for the Impact Expo, which is going on April 1st down in Tucson at the Chinese Cultural Center. So we're bringing out a lot of interesting activities and vendors and resources for the community, and hopefully even a training that will be running on the sidelines about homeless people and people who live in trauma and how you can learn more about what makes them tick and how you can deal with them. So you might want to join us April 1st down at the Tucson Cultural Center from 8 to noon. It's free and it's drop-in. So if you have nothing else to do on a beautiful Saturday morning, it has a beautiful outdoor garden and yard. So it's not all indoors now that spring is finally here. So thank you for both. And I wanted to ask you, Dan, if I could start with you, because I was so intrigued to discover your nonprofit, and I love what you do. So maybe you could tell us generally what your wellness council is, or what the mission of it is.
Sure. Well, thank you, Barbara. It's basically to improve the health of employees and their families. We work with organizations that really care about their people, and very fortunate that this all began 38 years ago and has grown, and we're actually beyond Tucson. It started as the Wellness Council of Tucson. Now we're the Wellness Council of Arizona. And we also have the National Partnership for Wellness. So we have organizations that we serve in California and Florida and in between. The largest organization that we serve is Los Angeles County. They have 100,000 employees. Pretty amazing out of little Tucson that we have that agreement.
That was what surprised me, because I'm from Los Angeles, so I could only imagine trying to serve people over there from out here.
Yeah. So the organization is committed to helping individuals, employees with physical activity, nutrition, stress management, self-care. We contract with employers directly, along with being a provider for Aetna, Blue Cross, United, Cigna. So we work with the health plans, the brokers, to design solutions and approaches to improve the health, total population of the health of an organization. Yeah.
I think it's so amazing that people are thinking this way now. It's, I think, a shift in how employees look at the world. And I think part of that came through COVID, as people worked part-time at home and started to think about life-work balance and how to do more self-care, especially if you're a leader in an organization. It's kind of hard to focus on self-care when you're trying to keep so many things going at once. So that idea, and that it's been around for so long, was really intriguing to me.
Thank you. It is a balancing act between work, life, personal needs, social desires, all those things. And those who are able to balance that beam the best are typically the happiest and most harmonious and most productive. And that's a real key. With COVID, as you mentioned, we've had a real challenge with presenteeism. People at work or engaged in work, but really not able to focus on work. And we advance the practice of mindfulness that helps with that, to help people be engaged in the present moment of what they're doing. And they get the most out of what they're doing. They give the most to what they're doing. They tend to have the feeling of the most control over their environment. So we're very fortunate that we've been advancing that for a little over 20 years, along with all the other things. And you mentioned, just thinking about it, awareness campaigns are a key factor. Getting people just to think about their health and whether or not they could be healthier and how that could happen. We also have educational offerings. So everything from individual health coaching to group sessions. And we follow that with behavioral change initiatives. How do you actually put that education into practice? So lifestyle challenges, everything from activity challenges, healthy body weight challenges, taste the rainbow, blood pressure, you name it, and it's there. So we're very fortunate that the employers basically sponsor all of these activities for the employees at no cost. So it's a great added value of employment to be able to have these types of support features at work.
Sure. We're members of the myriad chambers of commerce around the southern Arizona region. Mm-hmm. And we were giving a talk not too long ago about senior services at the Marana chamber, or I'm sorry, it was at the Tucson chamber. And there's a large desire, I think, especially for nonprofits that deal with social work, to help clients, to help the employees who are social workers find that life-work balance. And so there are a lot of those employers who are now employing social workers trying to find those kinds of things. So that might be a great opportunity for you, and for them. So I see this conversation quite often about, bringing some programs to the workplace. So that's kind of an interesting idea, a menu of things they can do. I've even heard, yoga on the breaks or meditation apps and things like that. So,
yeah. We serve a number of social service entities, COPE here in town, mm-hmm. and PEMA, Council on Aging. And basically, when you are serving a population, there's stresses that are beyond a normal work environment oftentimes. You're trying to help people that are in situations where they really don't know what to do or how to do it, and you're trying to help them understand, an approach and motivate that and inspire that to happen. So I've been very fortunate to be able to do it. I've been involved with the council for 28 years, and when I first came in, we were just really a coalition of employer groups sharing best practices and connectivity and that type of thing. And what we saw was that the employers needed support in these areas, and there was no one to do it. And that's really how we evolved into being a service-based organization. We're a nonprofit, but we're unique in that we don't receive any donations.
No?
Zero donations. So we're a fee-for-service-based model, but at a very reduced price because we are a nonprofit. We're not looking to satisfy shareholders or owners or that type of thing. So about 94, 95% of our revenue goes back into the programs that the employers are offering to their employees.
Well, that's terrific. I know everybody likes to support that kind of nonprofit anyway and looks for that where the money is directly serving or indirectly on those programs. But that's really exciting.
Yeah, Mel Zuckerman of Canyon Ranch.
Yes.
He and Enid started Canyon Ranch and founded that. Jim Click, Norm Land of the Good Earth Restaurant. Many people remember Norm. He's still riding his bike around town. All, got this together 38 years ago, and they all still have an interest and participation. Norm has served on the board for 38 years.
Oh, gosh, wow. Isn't that fun?
Really incredible. Our president has been on the board for 19 years, and he's been president for 18 of those years.
Wow.
And that's Doug Adelberg with Lovett & Touche Insurance. So we have a board that's committed to the mission, and we tend to keep our relationships a long time with employer groups and our board. And So we've been very, very fortunate. We still have our first client that we did health coaching with, and he's a great guy. Everyone knows him, Jim Click, and we've been doing health coaching with them for right at 23 years. So quite some time to be on site, and there are coaches here in Arizona and in California, 5 of them all together, and we're on site with their organization right at 100 hours a week.
Gosh, that's fantastic.
Yeah, it's an amazing commitment from an employer.
Well, and how great that everybody that's involved is so committed and for such a long time. Yeah. That's very fun. Yeah. Well, I look forward to hearing some more details and what it looks like. So that'll be interesting. But I also want to catch up with Kimberly. Kimberly is with Marana. I think of it as MHC, Marana Healthcare. So it's MHC Healthcare, correct? But you're not just in Marana. So maybe you can tell our listeners. I have to say, I use Marana Health Clinic. I personally have my physician through there, which was a coincidence, but it is so much fun. I love this organization. So maybe you can tell us how you're different from others or what makes you unique.
I think that we are wonderful, but I might be a little biased, but we actually at this moment have 16 locations, and everybody likes to call us Marana Health Center, but that is not correct.
I know.
We are MHC Healthcare, and because calling us Marana Health Center it makes us sound like we're just in Marana, and we're not. We have multiple locations throughout the greater Tucson area. We are also in Oro Valley. We are in Catalina. We are in, of course, now I'm forgetting everything.
Oh, sure. And you're all over. I think
we
that's
are.
the surprise.
We are all over. Let's see. Marana, Catalina, Oro Valley. Oh, Picture Rocks. We have a clinic in Picture Rocks.
That's fantastic.
I've driven out
There's not much out there.
Well,
so that's important.
There's actually a lot of people living out there. I've gone out to the clinic a few times just to meet people and look around, and oh my goodness, I was shocked at how many people live over there. I had no idea.
Yeah, it's beautiful. I think of it as
is.
really residential and not a lot of businesses out there. So there's a great place for healthcare.
It really is. It
Sure.
really is.
And I can appreciate the name. I don't know if the name changed as you grew, but I think in the beginning when I first moved here, I thought of it as Marana Health Center. I thought that's what the MHC was. But then it's the same with Impact. We used to be called Catalina Community Services, and people thought, oh, you have to live in Catalina to get service. And as we expanded, we had to change our name so people understood we're about making an impact on people's lives, and it's not just in Catalina. So sometimes a name is kind of confusing for the public.
I had no idea that Impact ever had a different name.
Isn't that fun? We've been around since 2000. Mm-hmm. Some people are surprised to find out how long our organization has been in business. And that's the purpose of this show, because I think the other thing is they say, well, we didn't even know you existed, or we thought you only ran a food bank. And then they're surprised to find out the millions of other things we do and the ways we help people. So I thought, oh, this will be fun to have MHC Healthcare on, and I think you're wonderful. We refer clients to you. And so maybe you can talk about your sliding scale, and it's not really a health, how would you define it? It's just kind of a group of clinics, but how is insurance involved, and how do low-income people get served?
Well, MHC Healthcare has an outreach department, and when we get a new client, they'll sit down with them, or even over the phone if the client can't come in, and talk about their needs and what insurances they have. We'll take any insurance. We have some people with fabulous insurance. We can take people that are underinsured. We can take people with no insurance. Our outreach department will sit down. They'll go over the sliding scale fee with you. Sliding fee scale, I always get that backwards.
Sure.
And see what works, and then work out a payment plan with you. We don't ever turn anybody away. And we accept just about every insurance that's out there.
Well, that's good to know, I think, for people, because a lot of times I just recently broke my knee. And so I was, trying to choose, well, where am I going to go based on who my healthcare provider will allow me to go to? And then needing some checking eyes, and I'm thinking, okay, so I get the list of approved doctors and the approved list of who's on my insurance, and then I try to match up to see who can get you in. It's kind of a challenge, I think, a lot of times in healthcare.
I have seen that over and over again and heard that so many people, they try, and not with us,
Right.
but they try to make an appointment and it takes them months to get in. Well, with all of our clinics, I mean, we hope that you can just choose the one that's convenient for you and that you can get in quickly. If you can't get into your provider quickly enough, we also have a quick care, which is located at our main location, and you can either walk right in or you can make an appointment. And that's the difference between a quick care or an urgent care, which we also have located at our Dove Mountain clinic.
Oh, that's nice to know.
Yes.
And I know I had used telemed, of course, during COVID, which was convenient. I'm an asthmatic, and so it was clear on telemed. I was struggling to breathe. I'm sure you can't do telemed for everything, but did that continue even after COVID? Do you still offer that?
We most certainly do. It started during COVID. We had actually been working towards it for a while, so it was already on our radar. But once COVID hit, it's like, boom, we have to do this, and we have to do this now. And the first ones we were doing it with was our behavioral health clients, our counseling and wellness center clients. And it was working so well, we continued to adapt it and grow it. And then all of our patients were allowed to do it too. Now, like you said, there's not everything can't be done over telemed, but many things can. And yes, we are continuing to do it.
That is nice.
It's wonderful. I've used it. I love it.
It is so convenient for certain things. And then what a great way to start it. It makes sense during COVID, the people that are in for behavioral health who are feeling disconnected through COVID, and to be able to connect live with a person, that was very clever.
And talk. So many people, they're home alone during COVID, or, it could be all the time. We have plenty of people like that too. And they have no one to talk to, no one. And they'll go for days without talking to another person. So the fact that they can not only talk to somebody, they can see the person through telemed, I think was very comforting.
Oh, sure. I can see where it would be. Well, that's exciting. I think that's just a great benefit, something positive that came out of the pandemic, for sure.
Absolutely.
So that's nice that you're keeping it up. Can you tell me something about integrated care, what that is, and how MHC Healthcare manages that? That might take me another 10 years to get that out of my head, but that's okay.
You and everybody else, we're trying so hard to get it across there. We're not just in Marana, we're MHC Healthcare.
That's okay. We changed our name 10 years ago, and I still get email to Catalina Community Service.
I know. Okay, good to hear. It's not just us.
No, it's people.
Integrated healthcare is the combination of behavioral health or counseling and wellness along with your medical. And we have, and with dental. And we offer just about everything there is to offer. We have all the services, and so it's all integrated. And say you're at a medical doctor's appointment, and they realize that you may need some counseling because you're depressed, you're having a hard time, you say something to your provider, and they then refer you to our counseling and wellness center, which at many clinics, it's right there, which is so convenient. So you don't have to go like from 1 to 20 miles across town to another. You can see your doctor, your provider in one clinic, walk down the hall and see your counselor or psychologist or psychiatrist, depending on what you need, and get the help that you need. And so integrated care is like that. We integrate all of it together as one, and we try to, so it's like a holistic healthcare. We try to provide everything, and we have all of the staff to provide, to take care of you and to offer this to you. And then we bring you in as part of the care team. And I think that's important.
I was just going to say it's a team then.
Oh,
versus
absolutely.
trying to get one doctor across town to coordinate with your other doctor across town. And I know we have all those services in the clinic I attend, and it is nice. And we refer clients who especially appreciate that, when you're a low-income client and gas is expensive, and if you only have to go to one location to get all your medical services and it's nearby, that's pretty helpful and very unique, I think.
It is. I think a lot of medical facilities have gone towards that, but I don't know how much they all offer. Mm-hmm. And we also have a transportation department that if like you said, you can't get there because you don't have a car, your car's broken down, or you can't afford gas, you call and you make an appointment, and you kind of go through the whole sliding fee scale with them too, I think, with our transportation department, and they can actually go and pick you up and bring you over to your appointment, which is wonderful.
It is wonderful, and I have to share with our listeners that is one of the ways I first discovered the organization, because at Impact, we had, prior to COVID, we had a congregate meal program as part of our senior meals. So we delivered about 80 meals a day out to homebound seniors that were home cooked in our commercial kitchen. And then we would serve to about 25, 30 people, a hot meal right after it was cooked in an activity center, but many of our seniors couldn't make it in. So we contracted with MHC, and their bus would go pick up all of our families that couldn't come in, whether they were disabled or they just could no longer drive. So that was pretty exciting, and we did that for many, many, many years. And then COVID kind of closed it up for us.
That's the unfortunate thing. I think we have 15 vans, and some of them are like so long, they almost all are like a bus because they're wheelchair accessible. So nobody's going to get left at home if we can provide them what they need.
Well, we probably will be coming back to you because we are getting ready as things open up again to bring those seniors back together. But back when they were the most vulnerable group, when COVID first started, we closed it up. And then we just delivered to them individually. But it's not the same, as you're saying, to have a congregate group, people that don't have a chance to talk to anybody. So we might be back sharing that bus with you between appointments.
Well, we'd always love to have you. MHC and Impact has been, I know it's over a 20-year partnership. Mm-hmm. I don't even know exactly what the year is at now, probably like 24 years.
It could be, yeah.
I believe so. And it's amazing. I love what we do for each other. I've just started in the last, probably 3.5 years when I really was like, who is Impact and why is their name on our website? And I asked around and nobody knew. So I think I looked up your website and I contacted Diana Charbonneau, who is amazing. And so we started communicating with each other, and I found out more, and I'm like, why don't people know about us being partners? So Diana and I got more and more involved, excuse me, and I really started trying to take part in all of your events and really bring us together more and let people know at our facilities that Impact is amazing, and we are partnered with them, and here's what they do for us, and here's what we're trying to do for them.
And I think it's great because we really can serve, our service area is so wide that we really can do all of our programming for most of your clients. And so it's not just you helping us as an organization, but literally our clients, not just in healthcare. But if your clients come and they need clothing or they need to help find a job that can give them more income to their household, all those things. So it's really the thing that makes Impact, I think, so unique is we have so many community members. We try to bring community members together because we know we can't do it all. And we all have the same client base in many circumstances. And so even with ICS, I once said it's silly for us to both write a grant for Northwest Tucson when we are serving the same people. So why are we competing for grant money? Why don't you write for these kinds of grants, I'll write for these kinds of grants, and we'll just make sure that our clientele benefit from both of them. And so that really is a way that we can reach out so much more and be so more effective. So we appreciate it. Thank you, Kimberly.
Thank you.
Dan, I was going to ask you more about the specific things that you provide for employers. So for example, Impact as an employer, with, say, less than a dozen employees, what kinds of programs would you bring to an organization like ours?
Sure. Well, thank you, Barb, for asking. Our core competency is health coaching. So in a year, we will average around 50,000 one-on-one sessions with people, talking with them about their goals in their health and designing a strategy to approach that. And it will typically involve physical activity, nutrition, some stress management, and overall self-care. In self-care, we look at three different groups. General populations, how does anyone obtain and maintain optimal health? And then there's folks that have disease states, diabetes, heart disease, those kind of conditions. How can they, through a lifestyle approach, improve that health status? And the third group are people with health conditions, headache, carpal tunnel, back care, things that aren't necessarily diseases, but certainly impact our productivity, quality of life, and pain, which, is a big driver. On top of that, we do lots of webinars and on-site group presentations. If you're going to spend an hour, you'd rather spend it with 20 people than one when you're trying to advance a message. And then those lifestyle challenges are things that we coordinate. As a matter of fact, we're kicking off a community challenge right now. We've done it for the last 8 years. This is called Stride Through Spring. And we'll have anywhere from 15 to 20 organizations all competing with each other. Last year, we had over 1,600 employees from 19 organizations compete for individual recognition, and also the top 20 participants from each organization form the team for that organization, and the average number of steps per person puts them in a first, second, third place. There's a traveling trophy, there's first, second, third place trophies, and then individual prizes, $100 for third place, $200 for second, and $300 for first place. So those lifestyle challenges help us to basically help people engage in the lifestyle approaches that are offered. On top of that, you mentioned fitness classes. Prior to COVID, we were doing over 350 classes a month at different work sites.
Wow.
Everything from yoga, Pilates, yoga lattes, Zumba.
I'm not sure I know what yoga lattes is, but it's a great word.
Yeah, and so we had to change all of that with COVID. We went virtual with everything. Much of our health coaching, our presentations, our lifestyle challenges, and our fitness classes went to a streaming process. We're now gaining more of that on-site presence back, and that's really the key to our approach, is eye-to-eye, toe-to-toe, establishing relationships with the employees that are long-term. They can help them, really have a great impact on their health. It reminds me of one of Bash's employees. The coach was speaking with them about their sleep apnea, and it was affecting everything else in that person's life because of energy levels and everything else. And so he addressed the sleep apnea, and all of a sudden got more physically active, started eating better, no longer pre-diabetic, no longer pre-hypertensive, and he lost 90 pounds.
Oh my gosh.
So, you're talking life transformation. He has 2 young children, and, he credits the fact that the employer had a health coach there that took an interest in them and encouraged him continually to address his health challenges.
That is a fun success story. I want to take just a quick break to hear from our sponsor, and then we'll come back and hear some more because it's so interesting. Thank you.
Today's program is brought to you by SKIP, the Social Service Contractors Indemnity Pool. SKIP is a member-owned, member-directed insurance provider with more than 3 decades of insuring Arizona social service organizations for their property, general and professional liability, and auto claim exposures. With an Arizona-based staff of claim underwriting and risk management professionals, Skip specializes in providing personalized service, affordable premiums, and coverage which meets and often exceeds the state of Arizona's contract requirements for social service providers. For more information, visit our website at www.sscip.org or ask your insurance agent about protecting your organization with insurance coverage through Skip.
All right, we're back, and I'm with Dan Johnson with Wellness Council of Arizona and Kimberly Mayfield with MHC Healthcare. And we were talking to Dan about, he was sharing a success story of one of his clients, or one of the employee clients, I suppose. And so that was just really fun to think how it can make such a difference.
Oh, thanks, Barbara. We're very fortunate. Each year at our annual meeting, we recognize personal achievements from employees, committee members who have gone above and beyond the call to help advance the mission, and also senior leadership. None of this would happen if it wasn't approved by someone in that C-suite saying this is an important initiative. We'll take the time, the energy, the effort, the money to help what they recognize as the single most significant factor contributing to their success. And that's our people. And you could have the best products, the best processes, all of these things that are tangible. But the most important thing for success in any organization are the people. So part of that's going to be how happy and how healthy are they. The happier and the healthier, the more likely they're going to serve the public or the entities that organization is working for and sustain long-term influential relationships. So we're very fortunate that we have committees at the companies, and the committees are employees that come together from different departments that give their input as to what their fellow employees might need or like. And you find it's different in all the different departments.
Oh, interesting.
The admin staff is sitting all day and the field staff is on their feet all day. Well, they're not probably going to need the exact same program or same support. So everything is customized based on what those committees come to the table with, looking at the ICD-9 claims of the organization, what's driving their healthcare costs. Their budget is influential in the programming. When we're looking at cost drivers, we look at typically the 5 top drivers in an organization and what are the available modifiable factors within those areas. We're not going to affect, renal failure, but we certainly can influence pre-diabetes, and the numbers are staggering. If someone does have diabetes and they take good care of themselves, they're following their medical recommendations, their lifestyle engagement, there's still a typical cost of about $10,000 a year for that medical cost. If someone is not managing their diabetes, that cost averages $30,000.
Gosh, I believe it though.
And per person. And the propensity rate in diabetes in the Southwest is 15 to 20%. So if you have, 10 people with diabetes that are not taking good care of themselves, there's hundreds of thousands of dollars there every year. Besides the lack of productivity, the loss in presenteeism, and lost work days associated with all of that. So each one of the areas has basically lifestyle approaches that can be engaged in. You're talking about cardiovascular disease, such a high propensity in our country. Well, there's some simple things you can do, and what we recommend is that people don't try to do a major overhaul of everything at the same time. We know that's not going to be successful. So we take one step at a time, and oftentimes we look at the Kaizen method. I don't know if folks out there are familiar with the Kaizen method, but it's from Japan, and it was used to develop their technology and their automobiles and all of these types of things, sound systems. But what you do is you take what is the very smallest next step I can do. And once you've taken that step, you say, what is the next very smallest step? And if you break it down into the smallest steps, it's manageable. You feel like you can accomplish that. If you're looking at taking giant leaps every day, we know that we can't sustain that. So we're not going to look at somebody's goals and say we need to change this, and this. We're going to say, what would be the easiest thing for you to work on right now? And then we go from there. We use a lot of motivational interviewing, and that technique really helps somebody identify for themselves what they might want in their goals and how to accomplish them, how to approach it, what would be best for them. So the coaches are armed with and fortified with human dynamics type of engagement. How do we get people to do what it is they want to do? Why is it that they don't do what they want to do? What's the difference between positive, negative, temporary, permanent motivation? And how do we combine all of that to get to permanent, positive motivation? And we're not all going to be on that track every day, all day long, but the more you're on that track, the more likely you're going to have some great success in your life and feel like you have efficacy and esteem in what you've done. So that's all also very individual. Everyone has different motivators and reasons why they do what it is they'd like to do and how to get that done. So I share the story about Canyon Ranch. I'm fortunate I get to speak out there a couple times a month and use the facilities. And a fellow that I used to work with worked there, and this was a number of years ago. And he said, Dan, you got to try this. It's called funk aerobics. And I said, well, gosh, Carlos, you know me. I'm already challenged with regular old aerobics. But you throw funk music into that and have me try to dance in a funk fashion while I'm doing aerobics. Somebody's going to get hurt. I should not go to your class.
It'll at least be entertaining for the rest of the class, right?
Yes, and I get done, and Carlos comes up and says, Dan, man, if you're ever really going to get in shape, you got to do funk aerobics 3 times a week. You just come on down. We're going to have a great time. This is going to be super. I said, whoa, wait a minute, Carlos. You got to understand something. If I am ever going to do funk aerobics again, you're going to have to do at least 2 things. First, turn down the lights.
I thought you were going to say the music.
And then serve margaritas. I am not going to do that in the light in front of straight people again. I don't move in a funk fashion. You want to go for a hike, a bike ride, you want to lift weights, play racquetball, I can hang with you for hours. But if you want to do funk aerobics, man, I'm going to watch. And that's what it is for everybody. If you don't find what's natural for you, that fits for you, you're not going to stick with it. Sure. And you got to go beyond just one thing. You got to have 2 or 3 things if you're going to have a lifetime of activity. You don't want to get burned out on what you're doing or get repetitive use, syndrome because you're doing it too often. So we suggest that people diversify, cross-train, have a number of things. And part of that is the fun of discovery, going to different things, giving them a try. I can say that, I did funk aerobics. I'm not going to say that I'm going to do it again. But when you find things that fit for people, and that has to do with even nutritional approaches. And, everyone has different desires about, what they want to eat, when they want to eat it, how they're going to prepare it, but what's the healthiest way to do it within what your, preferences are.
Sure.
So that's what we try to help people with.
Well, that's cool, and I can see how it would be helpful to people once they learn those little motivation techniques, to bite off a little bite and then move forward. That must also translate to everything else they do in life. Give them a skill set to tackle any big thing.
Exactly. I started my career as a cleanup spa attendant at European health spas when I was 17 years old. I became a fitness instructor when I was 19, and I was really amazed because I saw people set goals, and it was, to lose some weight or to hike the Grand Canyon or to do their first 5K or whatever it might have been, and they changed physically. But what I also recognize is that they changed holistically. Just by accomplishing that one goal, their esteem grew. They became more social. They were more outgoing. I saw this blossoming of somebody, multiple individuals, and it just really, grabbed my attention as to, human dynamics. Why do people do what they do, and how do they get that done? So I started reading everything I could about sales, because that's a big thing in human dynamics. about personal potential, and it's just something that has intrigued me for many, many years.
Well, I love your story, and this is on the website about your shoeshine job, your first shoeshine job. Maybe you can share that with the listeners.
Oh, you're nice. When I was 10 years old, my father bought me a used girl's bike. He told me he was going to weld a bar on it and paint it so it would be fine for me to ride, but he didn't get that for me to ride to school or have fun with my friends. He said, your mother's pregnant and we're going to have a fourth child and you're going to need to have a job. So this is your transportation back and forth to work. Well, I couldn't find anything really to do. I looked all around. He said, go up and down Broadway and go to businesses. And I ended up finding a barbershop that allowed me to become the shoeshine boy in the barbershop. And I hated being a shoeshine boy. I was the only shoeshine boy I knew. There were older kids, bigger kids that picked on me, but I got talking with two guys that got their hair cut there at Armando Sierra's next to the Kon Tiki, Broadway and Swan. The barbershop is still there.
Oh, fun.
And they said, you got to stop being a shoeshine boy. I said, well, I can't. It's the only job I can find. And they said, no, we didn't say that you got to stop shining shoes, but you got to stop being a shoeshine boy. And I said, well, I don't know what you're talking about. And they said, well, you need a new title, and you need to change your approach here. The barbershop, you're wasting a lot of time sitting there. Just hit that at the bottom of the hour. Take the guy that's coming in, the guy that's going out. And in between that time, go out to all these businesses, these office buildings, and go to these retail stores. All these people wear leather shoes. So, and they said, you got to change your title. And they helped me. These were door-to-door encyclopedia salesmen. And they're playing with a 10-year-old. And what I became that day was a Shoeshine Preservation Expert and Consultant. And I painted that on the side of my homemade box. And when I walked into somebody's office, on Broadway, who's going to tell that boy no?
I agree.
And I'd charge 25 cents for a shoeshine, and I'd typically get $1. So my tips were usually bigger than the cost of the shine. But that was my first experience in free enterprise. It taught me a whole lot. I did that for a couple of years, and I still am fond of those days. At the time, I hated it.
Well, of course.
But Shoeshine Preservation Expert and Consultant here.
Well, it certainly shaped who you are today and where you've ended up, I would think.
Yes, I was very fortunate. I told you I was a spa attendant at European Health Spas. I went on to go into management, eventually partners in different organizations, and I had partnerships in over 20 athletic clubs throughout the Southwest. Here locally, people probably remember Naturally Women Fitness Centers.
I loved that gym.
Oh, thank you. I came up with that name. I had 3 partners, and it was a great organization. Wish it was still around.
Me too, and so do my friends.
Yes, it was great. So very fortunate that I was able to take some of those lessons from Shoeshine days and put them into the health club days. Yeah.
That's too fun. Well, Kimberly, you have any crazy stories like that in your past?
Oh, do you really want to hear it?
Well, sure.
Okay, so I was thinking about this when he was talking about being 10 and learning how to do this. Do you remember the, what was it called? The Tucson Shopper? That little...
Yes.
Yep.
Okay.
The book?
I don't know how many people are out there who remember Tucson Shopper, but so I was 10, and I put an ad in there without my parents knowing. Actually, I put several ads in there without my parents knowing. And nobody asked at the time how old you were or what you needed to do, and it was free. It was free to put ads in for, I'm sure, just certain things, but what I was looking for was free. One of them was for, oh gosh, I'm trying to remember. One of them was for free. I had dolls for sale, and we started getting these calls, and my parents were like, Kimberly, which means I knew I was in trouble. Another one was something about cats, and I can't remember why, and I got another one of those Kimberlys, and I thought, uh-oh. And then the other one that I really remember was I put an ad in saying, because I loved horses. I was an absolute horse freak. And I said, I will clean stalls, I will groom horses, I will do anything you need that have to do with your horses. I think I was about 11 when I did this. And I got jobs. But I needed rides to my jobs. And my parents are like, what have you done now? You are not allowed to call in ads with them anymore. But they did. They took me to a couple of those jobs, and it was great. And I made money. But even better, I gained experience with the horses, with doing different things, and with making money.
Well, and I think it shows how I was thinking about when you're passionate about something, how joyful it is to work. And I think that's part of that life balance. If you can find a job where you're passionate about what you're doing, most kids might not want to muck a stall, but if you love horses, then you're in your element. And so it's the same thing. And I think that coaching and helping people find health and helping motivate them one little step at a time has to be so rewarding. And I know I feel that way in my job. To be able to help people and make the difference that we do is, I don't know, just fills your heart. So I think there are a lot of people out there who have jobs who don't necessarily love what they do, but it is nice.
It's a
that
job,
they
not
found
a
it.
passion.
Exactly.
But, I know for me, and I found this with my entire life, not just work, but where I have always worked in my life has been the healthcare industry. And that doesn't surprise me when I look at it, because more than anything in the world, I like to help people. When people give gifts, like at Christmas time, I'm so uncomfortable. I like to give the gifts.
Sure.
I like to give gifts to people. I love to give people things. I'm constantly donating things to organizations, or those boxes you can drop things in for Goodwill. Or I know up in the White Mountains where I lived for 17 years, they had them for Big Brothers Big Sisters. If I could find one of those down here, I'd be thrilled. I would clean out my closet to where I hardly had anything left to wear, because I wanted to give all of my stuff to these people that didn't have anything. And that makes me feel so good. That fulfills me. And I know it's helping other people. I'm a helper.
There you go.
I want to help everybody.
Well, that's probably part of the reason all these nonprofits are so successful, when they're led by people that care and enjoy what they're doing. So I thank you both for that, for what you do. That's pretty cool.
Thank you, Barbara.
Yeah. Can you tell me about, I think you have a new CEO over at MHC, correct? So
We do. He's amazing. I loved the CEO that we had when I came there, and he left. And it's kind of a funny story, because he left to become the CEO at El Rio, and we all gave him a horrible time about that.
off to the competition.
Yes, but then our new CEO is from El Rio, so we kind of traded.
Oh, that is funny.
It is, and his name is Dr. Dr. Josh Carzoli, and he was this chief operations officer, I believe, at El Rio, and he's been in healthcare for decades, and with a lot of, like, El Rio is another FQHC, which is a federally qualified health center. And so he went from one to another. So he knows how it works. He understands the passion. He has the passion. And I love that. And he is so nice. He's been going out to all of our clinics and introducing himself to everybody and getting involved in things. And, we've only had him around for a few months, but I'm really looking forward to moving forward with him. And I think he's going to do some amazing things for MHC Healthcare.
Very nice.
I'm excited.
We'll watch for some innovative changes, it sounds like.
Oh, there will be.
Very nice. That's fun. Well, I know all of this information is on the show page on how to contact these organizations. But Dan, I did have a question for you, and that was, if I'm an employer, like what kind of employer? I was thinking about, boy, wouldn't MHC like to have this for their employees? Seriously, and Kimberly's nodding yes, because it seems like such a practical win-win for everyone. But I was thinking, when I asked about impact, so do you do small businesses as well as larger? Obviously, the gym clicks and some of these corporations are so huge, but I was trying to think, if I'm an employer, how do I get a hold of you? Not from the research, or not from how to look up contact information, but what do I have to be thinking about to call you and have answered questions for, or information for you?
Sure. Well, in the comparison between the large employers and the smaller employers, and we serve every different size there is, let's take an employer that has 10,000 employees. If 20% aren't able to come to work, are they able to build their widgets? Probably not. You take an employer that would be missing 2,000 people. You take an employer with 5 employees, one is missing, that's 20% of the workforce, just one person. So in a way, the smaller employer has a bigger motivation, larger motivation to keep their employees happy, healthy, producing, and engaged than a larger employer. Larger employer could have a number of people who are engaged in presenteeism and not producing, and nobody would ever know it. But in a small organization, if somebody's not pulling their share of the load, everyone knows it. So it doesn't matter whether you're large or small. Now, what does have an influence there is whether or not you can influence your healthcare costs. A larger organization typically is going to be self-insured, and so the impact that you have can have a greater influence on your cost of care. A smaller employer, typically under 100 or 50, is going to be fully insured, and their insurance rates are grouped in with other businesses their size to create that aggregate and project their cost. So you have very little influence with a smaller organization on their cost of care. The way that we really got on the map or on the radar screen was Jim Click allowed me to be a health coach for their organization 24 years ago. And I was the only health coach. And we were just trying to get people to go to the doctor, take care of themselves, do the things that are good for their health on a day-to-day basis. And Mr. Click told United Healthcare that he wanted them to do an actuarial audit and just see what the impact was. And so United, wanting the renewal, said, well, sure, we'll study the second and third year of your cost factors. Chronic care, not critical, but just chronic care. And in that 1 year, second to third year, they saw a $600,000 reduction in chronic care cost.
Wow.
Goodness.
Yeah, pretty amazing. That year, the average rate increase for a fully insured auto dealer was 25%. That's on a national average. Jim Click's that year was 5%.
Oh, nice.
So that audit translated into saving the company and all the employees, because, you know, everybody shares in the cost of care and insurance premiums. But his effort in investing time, energy, effort into helping his employees think more about their health and be better engaged in their lifestyle and their medical care translated into an incredible influence. So with that, we were able to then start one by one gaining different organizations. We now serve just under 500 work sites through the Wellness Council. Not organizations, because many organizations have multiple sites, but and that does not count LA County. That counts them as one because they would be, 500 on their own. And again, it's driven by the organization's goals and vision for what it would take for their population to become healthy. Yeah. So to get back to your original question, all they got to do is call us and reach out, and we're happy to help them. We meet with the organizations prior to any contractual relationship and help them see whether or not this is a good strategy for them and how it could happen.
And you can do things on the campus, but then also people are doing things at home, it sounds like. Is that correct?
Definitely. Yes.
Sure.
Yep.
So it sounds like a menu of things you can select from.
Mm-hmm.
Yeah, I'm excited because I think, as I said earlier, I see so many businesses trying to find additional perks for their employees. We can do a 401k plan, we can do a life insurance, and those are tangible and they are important, but they don't really change the quality of life today. So that's kind of interesting to see. I have seen all these apps and things that people can bring in. So that's an interesting one too.
We do work with an app called Levelhead. Dr. Sandra Schrock developed it, and many of our organizations use it, but it's mindfulness in tidbits. So 1 to 3 minute messages that are right there on your phone. Anytime you have a moment or you feel stressed or you've got some anxiety, you can pop that up. There's a number of different areas. And TEP, our power company, has engaged that app. They're going on 4 years with their employees, having that in-your-hand resource at any time that you might need to calm down, take a breath break, whatever it is. It's called Level Head. It's great.
Oh, that's fun to know. I'll look into that. Thank you.
Yeah.
Kimberly, I was going to ask you if you have any new exciting services coming up. And I also wanted to talk about the other ways you support community other than just impact.
Actually, this is a service that's coming up, and I'm super excited about it. MHC has developed a family residency program, and it should be starting this coming summer, we hope. Well, yeah, that's when our first class should be.
Gosh, that's tomorrow's summer.
I feel like it's almost today, but yeah, I get it.
It is.
Anyway, the Family Medicine Residency Program, we earned our accreditation. We expected the programs to have our selected residents start in July of 2023, which is super exciting. A benefit of the Family Medicine Residency Program is that it's going to provide a greater number of primary care physicians, yay, to Tucson, to deliver much-needed medical services to patients in our community, which is, we need more providers, guys. We all know this. We need more doctors. The program is planned to have 4 new residents each year, and they will train for a total of 3 years before they're eligible to take their specialty board examinations, which should be the family medicine exam. The residents are going to be supervised by our attending physicians, and they'll gain all of the knowledge and all of the skills they need through hands-on training, which is super cool. And we'll teach them how to provide the required care for all ages. We've been working on a new building in Ina and Shannon where the residency program's going to go.
Oh, nice.
Because it's going to be pretty huge. I know it sounds like only 4 residents, but you also have all of the staff providing that. You have the auxiliary services that will be there to support them and that they can learn. I'm just so excited about this. This is brand new for MHC. We've never done anything like this.
Well, that's exciting. We're going to have to keep an eye open for that and check back in with you over the summer and see how it's going. And I want to thank you both for coming in today and give you an opportunity to add anything else that you want the listeners to know about that maybe hasn't come up. So do you have any?
I would like to say that MHC actually does have an employee program, much like what Dan's talking about. I'm ashamed to say I don't know who they are, and I don't know everything they offer. I know we've been giving some apps like Balance to do a lot of what you were just talking about with Level Head. I think there might be another one. And we are involved in a STEP competition with other medical facilities right now.
Well, very good.
Yeah, it's a lot of fun. But I need to learn more about it because listening to Dan today has just blown my mind. I am so excited about everything he said that now I want to see if we offer all the same things. And if we don't, then I'm going to need to talk to somebody.
There you go.
You're very nice, Kim. I've actually spoken at MHC Healthcare in the past. It's been a number of years ago, but a lunch and learning session for employees at your main campus. Yeah.
And I did not know that. It could have been before I was there, though.
Oh, yeah, sure.
But that's what this is all about, bringing people together. So
Absolutely.
I'm thrilled that you both connected and have taught us all so much. I know I'm thinking, we should bring some of these things to impact as well. So thank you both for joining me today and for sharing all you do and all you know with the community. And I hope you have a wonderful spring day. It's sunny and warmer here in Tucson, so we're off to hit the outdoors.
Thank you, Barbara.
Thank you again.
Thank you, Barbara. Thank you, Kim. And I want to wish everybody strength, energy, and vitality. Have a great day.
Thank you, Dan.